Good morning, everyone. You are very welcome to the Sunbed Use and Risk to Health Awareness event. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Your host for today is Dr. Breda Neville, HSE National Cancer Control Programme. Thank you.
There's a lot of discussion online about the use of sunbeds to get a tan or to tan before you're going on holidays, and also the use of Melanotan, either as an injection or as a nasal spray, to intensify the tan that you get from sunbeds. And they completely increase your risk of getting skin cancer. One, because the sunbeds superdose your exposure to UV radiation, and the Melanotan just makes that worse. There's no such thing as a safe tan, so you could be literally dying for a tan.
Good morning, everyone, and welcome to today's webinar on sunbed use and risk to health, which has been organised by the HSE's National Cancer Control Programme. The NCCP coordinates the implementation of the National Skin Cancer Prevention Plan 2023 to 2026, and one of the key action areas of which looks to develop, disseminate and evaluate education and community outreach initiatives tailored to population groups where usage of sunbeds is highest. So we are continuously identifying and pursuing opportunities to further raise awareness of the risk of sunbed use. Skin cancer is the most common cancer in Ireland amongst both men and women, with 11,000 cases diagnosed every year, and this figure is projected to double by 2045. Using sunbeds increases your risk of developing skin cancer, and the earlier you start and the more frequently you use them, the greater the risk. So people who first use sunbeds under the age of 35 increase their risk of developing melanoma skin cancer by 75%, and anyone who has ever used one is at least 20% more likely to develop it. IARC, the International Agency for Research on Cancer, has classified the use of UV-emitting tanning devices such as sunbeds as cancer-causing in humans, which puts them in the same category as smoking and asbestos. And SHEAR, the European Commission's Scientific Committee on Health, Environmental and Emerging Risks, has stated that there is no safe limit for exposure to UV radiation from sunbeds. So we hope that today's webinar will help community groups and organisations who work with sunbed users to understand the risks associated with sunbed use, debunk myths around the use of sunbeds, and raise awareness of the importance of sun protection and skin cancer prevention. And we hope that those who attend today's webinar will help spread awareness of the health risks associated with the use of sunbeds. Today's webinar is being recorded, and the link will be sent out following the event so that you can watch it back later. You can add any questions that you may have to the chat function. Where possible, these questions will be answered at the end of the webinar during the panel discussion. And if that's not possible, a member of our team will get back to you directly with the response. Just to note that we cannot answer any individual medical questions or give out any individual medical advice. We'll have a short comfort break at around 11 o'clock so people can have a chance to get up and move around. So we have a great lineup of speakers today. So now I'd like to introduce the first of those. So Professor Shirley Potter is a consultant plastic and reconstructive surgeon at the Mater Hospital and the Blackrock Clinic in Dublin, and she's an associate clinical professor in UCD. She specialises in melanoma and advanced skin cancer, as well as head and neck cancer reconstruction. She did her fellowship training in the Peter MacCallum Cancer Centre in Melbourne, Australia. She's a recipient of the Irish Cancer Society Clinician Leadership Research Award and conducts translational and clinical research in the field of melanoma. She's a skin cancer clinical lead with the NCCP and is co-chair of the Irish Melanoma Forum. And today, Professor Potter will discuss the health consequences of using sunbeds and some of the sunbed-related issues that she sees in her clinical practice.
Good morning. The title of this talk is Consequences of Using Sunbeds, Health Risks and Aging Effects on the Skin. Many thanks for asking me to present at this webinar, and I apologise that I'm not there live. So by way of introduction and to let you know my background in skin cancer, I'm a consultant plastic and reconstructive surgeon at the Mater Hospital in Dublin and Blackrock Clinic in Dublin. I'm also associate clinical professor in UCD, where I conduct translational research in skin cancer in the Conway Institute. I'm also one of the national clinical leads in skin cancer with the NCCP. I'm chair of the Irish Melanoma Forum and a chief investigator with Cancer Trials Ireland on international melanoma surgical trials. So a good bit of background in terms of skin cancer management and treatment. So by way of introduction to this presentation, I'll signpost with an introduction to skin cancer in general and in particular skin cancer in Ireland. And then I'll go on to describe the deleterious effects of sunbeds in terms of skin cancer and skin aging. Skin cancer is the most common cancer treated in Ireland, and it outnumbers all other cancers. And each year we treat about 13,000 cases of skin cancer in Ireland. There are many different types of skin cancer, and these are the three most common. The first being basal cell carcinoma on the left of the screen, which is a very common tumor of the skin. And however, it is not very serious and causes the least in terms of morbidity to patients. The central one is a squamous cell carcinoma. This is usually an ulcerating, crusty type lesion. Again, very common, but it does tend to spread and can be more serious and aggressive. And the one on the right is a melanoma. This is a pigmented type of tumor, brown or black patch on the skin. These are not as common, however, they are much more serious in terms of the effects that they have on patients. So given that most Irish people wear suntan as a badge of honour, and most Irish people have a very fair complexion, we do have a significant skin cancer problem in this country. Melanoma in particular is one of the most aggressive types of human tumour when you compare it to all types of tumours we see in humans. It's the fourth most common cancer in males and females, and its incidence and mortality in Ireland are amongst the highest in Europe. Melanoma and skin cancer in general are increasing year on year, and we're going to see an explosion in skin cancers due to lack of awareness in terms of what it looks like, and also a lack of sun protection measures that have been taken over the years. And it's expected by 2045, we'll at least see a doubling of the incidence of skin cancer in Ireland. When we look at melanomas in particular, melanomas appear as a brown or black patch on the skin. About a quarter of them occur in pre-existing moles, and about 75% of them occur as a new mole or a changing new mole. So we use the ABCDE system when we're looking at moles to identify whether or not a mole is suspicious or not. So a mole can be termed suspicious if it is changing in terms of its asymmetry. It's no longer a circle or an oval shape and it becomes an irregular shape. If the border looks very irregular with little arms sticking out, if the color starts to change in terms of different shades of brown or black or even pink, if the diameter changes, we describe things as over 6 millimeters as becoming suspicious. And also if a mole is changing or getting satellite lesions or changing in a different direction. So the lesions along the bottom are all melanomas of different types and all raise an index of suspicion and would warrant clinical treatment. We also use the ugly duckling sign, whereby we describe a melanoma or a suspicious mole as a mole that looks different from all of your other moles. So these are ones that should be checked by either a GP or a dermatologist. In terms of the causes of melanoma, 90% of them, i.e. the vast majority of them, are caused by exposure to sunshine and UV light, be that chronic exposure over the course of a lifetime or short, sharp bursts of exposure in the younger years causing blistering sunburn. So saying that 90% are due to sun exposure, that means 90% of skin cancers, and melanoma in particular, are probably preventable with the proper measures. 10% are caused by genetic factors that we can do nothing about due to linkages within families and genes passed down through generations. These are some of the information posters that we had up in the hospital during Melanoma Awareness Month and Skin Cancer Awareness Month, which has just gone in May. And they give some of the stark statistics about skin cancer and melanoma. So if you look at this one on the left, it says that 3 or more instances of severe sunburn before the ages of 20 increases the risk of melanoma later in life by 2 to 4 times. And the one on the right is probably even more striking and more relevant to this presentation, stating that people who use sunbeds for the first time below the ages of 35 have a 75% increased chance of getting a melanoma. So what are sunbeds? Sunbeds are devices that emit ultraviolet or UV radiation with the aim of tanning the skin. UV light comes in different types, but mostly in UVA and UVB. UVA has a longer wavelength, and as you can see here, penetrates into the deeper layers of the skin and is more associated with the aging and the wrinkling processes that happen because of sunlight. And UVB is a shorter wavelength. It penetrates less into the skin, and it's the type that causes burning and in particular associated with skin cancer risk. Both UVA and UVB are associated with skin cancer risks. So what are the health risks associated with sunbed? Well, definitely skin cancers. And as I've said before, sunbed use increases the risk of skin cancer by 75%, which is quite a striking statistic. And that would be in terms of melanoma, which is the most serious type of skin cancer, but also in terms of non-melanomas, which would be the basal cells and squamous cells that I mentioned previously. And this increased risk is associated with the increased frequency or the number of times you use a sunbed or the longer you use a sunbed for. Also, using a sunbed in the younger years, especially less than 30, significantly increases your risk. And definitely people with a fair skin or very pale Irish red hair, freckles, that type of skin definitely has a higher risk of developing skin cancer from sunbed use. So the World Health Organization has classified sunbeds as a definite carcinogen, i.e. they definitely cause cancer. And they would come in the same category as smoking and asbestos. So quite significant. And a significant statistic that I reached out from the UK is that an estimated 100 deaths occur per year from melanoma associated with sunbed use. And if you look at this infographic from the WHO, they show the striking statistics of before the age of 35 using sunbeds. They state 60%, with evidence would definitely show up to 75% for melanoma risk. And also using them below the ages of 25 increases your risk of squamous cell carcinoma by 102% and basal cell carcinomas by 40%. So quite significant statistics associated with sunbed use and skin cancer. What are the other health risks associated with sunbed use? Well, definitely eye damage, and they cause cataracts and ocular melanoma. That's a type of melanoma that occurs within the eye and is really quite serious, as well as causing sunburn around the eyelid skin, which is again quite unpleasant. The sunbed and UV exposure associated with sunbed use causes weakening of the immune system, reducing the body's ability to fight off infections and other diseases. Sunbed use and UV exposure causes direct damage to the DNA within our skin cells, increasing the rate of change of the skin cells and leading into other types of cancer. And just a myth that I'd like to bust is that you don't need to use a sunbed to get enough vitamin D. Unfortunately, that's not where it all stops, and sunbeds have a significant effect on photoaging or premature aging of the skin, and that's an accelerated process that occurs because of UV exposure, and in particular UVA. The visible signs that we see on the surface are wrinkles and fine lines, loss of skin elasticity, hyperpigmentation or age spots, which are brown patches in the skin, and a rough leathery texture to the skin. So the mechanisms of skin aging caused by UV light, UV radiation degrades collagen, which is a protein within the skin that causes skin firmness and elasticity. It causes damage to elastin, again another protein in the skin, which gives the skin its bounce and resilience. And it causes increased free radical formation, which damages skin cells and leads to accelerating aging. The picture on the right of the screen is a gentleman from Australia who worked as a truck driver with the window down for prolonged periods during the day with high UV exposure. And you can see the left side of his face, which would have been exposed to skin for chronic periods over the course of his lifetime, shows dramatic effects of aging, whereas the right side of his face has significantly less signs of aging because of less UV exposure. Here are just some other examples of UV exposure because of sunbeds. And I give you the example of this young girl on the bottom left of the screen. The image that we would like to portray as a healthy image is that of an untanned skin. Any tan is considered unhealthy and definitely has caused some damage to that skin. The top right of the screen is an actress who has used sunbeds for 20 years to increase the glow of her skin. And you can see under the UV light the amount of damage that's there, and it will come to the fore as she ages, resulting in earlier aging and increased risk of sun cancer. And the image on the bottom right is a young girl called Sandy, whose image in the center is shown as it is today. And then software has predicted it as she would be at the age of 52 without sunbed use, not looking too bad. And then with sunbed use on the right, with significant effects of aging and wrinkles and fine lines and loss of elasticity of her skin. So what we'd like to promote is safer alternatives to sunbeds, and these are available readily over the counter, and these would include lotions, sprays, and self-tanning products that do not involve UV exposure and give you the same appearance, and also to promote protective measures, encouraging the use of sunscreen and protective clothing that you'll hear about later in the webinar, and limiting the exposure to sun, especially in the peak hours during the day. So to conclude, skin cancer is a significant public health problem in this country. UV exposure is the cause of the majority of skin cancer, and therefore the majority of skin cancer is preventable. There are significant health risks associated with sunbed use, and these include skin cancer risk, eye damage, and damage to the immune system. And also, importantly, the secondary effects on skin aging and the accelerated aging that sunbeds cause on the skin, with visible signs and also internal damage. And we would like to encourage everyone to consider safer alternatives and to prioritize long-term skin health over a temporary tanning. I'd like to thank you for your attention, and I'm happy to answer any questions if you want to send them on to the organisers. Many thanks.
Thank you, Dr. Potter. Our next speaker is Selina Gallagher. Selina is a Senior Environmental Health Officer with the HSE's National Environmental Health Service, and today she'll give an overview of the Public Health Sunbeds Act 2014 and how the legislation is enforced by the HSE's Environmental Health Service.
Hi everyone, my name is Selina Gallagher and I'm a Senior Environmental Health Officer working with the National Environmental Health Service at the HSE. It's really lovely to have this opportunity to speak to you all today. It's important that we educate all young people and adults in relation to the risks of using sunbeds, but it's also important to highlight that there is legislation in place, and this legislation is enforced by environmental health officers working at the National Environmental Health Service. So why are sunbeds popular? Sunbed use and risks, legislation and who enforces the legislation, what is covered in the legislation, what to watch out for, how and why are minors gaining access and using sunbeds. So these are some of the areas that I'm going to discuss with you all today. So the reason sunbeds are still popular is that some customers want an all over even tan. They want a tan that's not going to streak, that's not going to be patchy, that it looks natural when they're at the pool or the beach. Some people believe that it can clear skin conditions such as psoriasis, eczema, acne, and maybe potentially diminish scars from these skin conditions. Others people use sunbeds for body confidence. They feel that if they have a suntan, they look healthier and they glow. Some people use sunbed for a vitamin D source, a healthy skin and healthy bones. Others feel that it may relieve some seasonal affective disorder, which often can occur in wintertime, in the darker, when it's darker. Sometimes people may be easily influenced, for example, peer pressure amongst minors. And then others are still tempted and lured and enticed with the offers that are promoted within the sunbed businesses. It's often marketed as cheap and no fuss, and you can sometimes use premises if it's the same owner that if they operate a premises in, for example, Wicklow, they may have another premises in Dublin, and they may have another premises in Kildare, and it allows a customer to use all those premises throughout the country if they are traveling. So it gives them flexibility, no fuss, no pressure, and can be often as cheap as €1 per minute. So it's so important that we are aware of young people and their use of sunbeds, and how they are influenced by social media and by each other. And often young people are risk takers and they don't care about anything other than the tan. However, if they saw the damage the UV and the sun rays can have on their skin, they may think again. The blistering, the burning, the scars, the rashing, the peeling, sometimes it may increase growth in a spot on their skin or a mole, and that may need to be operated on and removed and then leave a scar. So they may think twice if they ever had encountered any of these horrible things. There is no other way but to say that there is no way or safe way to use a tan or a sunbed or get a tan. Using a sunbed increases the risk of getting skin cancer. And a suntan is a sign that your skin is damaged by UV radiation from the sun or using a sunbed. So I did say earlier on that there is sunbed legislation. It's the Public Health Sunbed Act 2014, amended in 2015. This applies to sunbed businesses only, so please bear that in mind. It doesn't apply to hospitals. Any patient under the supervision of a doctor or a medic is obviously responsible under their guidance, and this legislation only applies to the sunbed businesses. Anything that's done under the supervision of a doctor at a hospital is executed responsibly at the correct dose with using the correct machines. And as I said, the legislation is enforced by the environmental health officers working at the National Environmental Health Service, the HSE. So back in 2014, the service did a lot of work educating the sunbed business operator in relation to the law. So it wasn't a case the law came in and the officers all went out enforcing. There was a lot of education, there was a lot of communication and compliance building with this type of business, with the environmental health officers and the sunbed business owners. But now we're in 2024, so they're well used of the legislation and what's covered in it and how to control and be compliant. With any legislation, there's always an objective, and the objective of the Public Health Sunbed Act is to protect children and those under 18 years of age from the risk of sun damage. Anyone under 18 is not allowed to use a sunbed. It also is to regulate the use of sunbed by those over 18 or more, so to make sure that anyone using a sunbed, that those sunbed businesses are have notified the HSE and that they are being inspected and compliant with the legislation. And then also the legislation is to promote a greater awareness across all age groups. So this is about informing the members of the public that it is UV radiation, it is sun damage, and with that potentially can increase the risk of developing skin cancer. So what is covered in the Act? I'm not going to go into too much detail. I'll just quickly maybe run through some of the things that are covered. Basically prohibits the underage use of a sunbed, sail or hire to anyone under the age of 18. It requires anyone using a sunbed that they're provided with eyewear, that eyewear is compliant with and has a CE code. And basically that sunbed and the building that's used is hygienic. That the sunbed business operator is providing anyone using the sunbed with the health information. It prohibits marketing practice on site and any social media site where there may be a sunbed marketed. It prohibits health claims, get your vitamin D or improve your immunity, helps relieve eczema and skin conditions. And it also requires the sunbed business owner to display warning signs on their premises and on any social media website where they're promoting the use of a sunbed. So basically anyone using or booking online knows from the get-go that anyone under the age of 18 is not allowed. Those warning signs are clearly displayed. And within the legislation, there is a requirement that the sunbed business notifies the HSE of their business, and then it's inspected by the environmental health officers. So environmental health officers carry out a number of inspections for a variety of reasons. So it could be a routine inspection where everything is covered as part of the legislation. It could be an inspection of the social media website because signs aren't displayed or there's marketing or health claims made. It could be on foot of a complaint for whatever reason. It could be a mystery shopper where an enforcement officer will go in and test that person operating the sunbed against the legislation. So often what they might say to the inspector on their routine inspection may not is not reflective to what's happening on a day-to-day basis. So we'd send an officer in pretending to be a customer, and that we would ultimately test that against the legislation. And then test purchasing, and that also involves sending a minor in to see if they can access the use of a sunbed. So the only way we can do the mystery shopper, the test purchasing, is actually sending someone in posing to be a customer, and that's a good reflection of what's happening on that premises. And with any legislation, there's enforcement. So there's fixed payment notices that can be served, and they're quite pricey. For every non-compliance is €300. So often, if there is a non-compliance, it's never just one. So it could be a hefty fine, and that is a good deterrent. Also, there's prosecutions for whatever reason that officer is going to go to court for. But ultimately, if there is a sale to a minor, it's a no-go. The protection of the minor is always priority, and if there is a sale to a minor, there will be prosecution, and we have taken prosecutions, and there are ongoing prosecutions. So these are things that officers are doing on a day-to-day basis. So what role do we all have? So there are areas that members of the public, professionals, working with minors, parents, guardians, we can observe and watch out for at sunbed premises. You may be walking past a sunbed business daily from your commute to work, either from the bus or the Lewis, or going from the office to the car. You may have concerns with some of the girls or boys in the local football club, getting tans, or listening to conversations, and that may sort of give you a reason for concern. So if that's the case, you can go to the HSE and discuss any concerns you have before you log a complaint with the environmental health officer. But these are the things that you can be watching out for at those sunbed premises. So are they displaying their warning signs on the premises? There's also, are they displaying their warning sign on the social media website that they are promoting the use of the sunbed? So if they are on the premises, you will see the name of the premises written, and there will be a sunbed business notification number. So that also is an indication that they have registered with the HSE and they are regularly inspected. So they should be really visible and in immediate sight when you enter the premises. And marketing practices, they could be on the window, they could be on the social media site, as I said. No free of charge in the use of sunbed is allowed. No conditional reduced pricing, which would include happy hour, early bird, no loyalty cards, vouchers or bonus points in order to use a sunbed. No reduced price offered or advertising or the promotion of above. Book 1 hour, get the half hour free. Buy 9 sessions and get your 10th session free. So you can't be marketing like that. If someone's going to use a sunbed, they will be paying per minute on that sunbed. And if there is a package, that it's still the same as per minute if you went in as a customer. Also, if you had concerns and you were on a sunbed, you want to make sure that they are providing protective eyewear. Eyewear is so important. So the sunbed business operator needs to provide eyewear, and that should be advised every time someone uses the sunbed. Before they go down and use the sunbed, they should be invited to wear the eyewear. Often there's winkies, which are the golden ones there displayed on the presentation. You may have reusable ones, eye goggles, and they need to be cleaned and disinfected. But they need to be given to the customer, or the customer needs to be shown where they are and advised to wear them during their sunbed session. If a customer has their own, well, then that person behind the counter should be looking to see before they go down to use the sunbed, they should ask to see that they have their goggles. Also, that these eye goggles are CE approved. So there is certain goggles that have to be used for the sunbeds, and that's something an environmental health officer would also be checking. As I said, the prohibition of health claims. So the promotion or the benefits of using a sunbed is not allowed. So you might see these on the sunbed unit themselves, on the window, within the premises, on leaflets, maybe on the social media website. So, you know, get your glowing tan, your golden tan. That's not allowed. Anything that's promoting the benefit of using a sunbed is not allowed. There is no benefit of using a sunbed. Vitamin D source, increase your immune system, relief of the seasonal affective disorder, use a sunbed to help clear your skin conditions. All of that is not allowed, and that's the prohibition of health claims. Also, for any person 18 or more, every time they use a sunbed, they need to be given the health information, and that basically goes into the cancer risks, the eyewear. Every sunbed session is another risk of developing cancer. So everyone using the sunbed should be given this to read and understand, and then obviously sign it to show that they have done that. And that's not just once, that's every time they use it. Even if they're a regular customer, every session, as I said, is another risk of developing cancer. So that is something that also the environmental health officers will be checking, that the information is there and that people are given it when they observe during their inspections, and that the information is signed by the customer before they go down to use the sunbed. So how are minors still gaining access to sunbeds? So ways minors are getting into to use the sunbeds, that they're not providing true and accurate information. And our main goal is to get the tan. They'll do whatever it takes to get it. So they will lie. Also, some sunbed businesses, you can create the account online. So before they even step foot in a premises, they can get all this information set up. So basically all they need to go in and say is, I'm Sarah, whoever, my account number is this, and I want to use the sunbed, and off they go. There's less questioning, less confrontation, less time hanging around at the reception area. There's no embarrassment. So they're creating, and then they're putting the fake age in. So that's another way, just lying and the speed, and the information is there. So when it's busy, yeah, I have my account, it's this, and then off they go. Often minors are identifying premises that they are getting into. They are also checking premises that are easy to access and commute to and from. So they're going from the Lewis or the bus, and they'll stop off in, for example, Tala, or they might stop off in Dundrum, and then if they don't get in there, they'll get back on the Lewis quickly and keep going into the city centre. So they're not wasting time. And then the other guys know, oh, we got into this place on whatever street in town, and then the others come straight in. So they are picking premises that they can just commute easily to and from. And then parents don't have to bring them around so they're not flagged on why are they going here, why are they going all the way here to use these premises. So they're not flagged either. They're quite independent and commuting between different suburbs. Often also minors are using siblings' details and accounts and topping up cards. So they just go in and tap. And they go in pairs, always in pairs, or maybe 3 or 4. They just egg each other on and they increase confidence. If one stumbles, the other one steps in. Oh yeah, she's 18, of course she is. So they have that support. So that's another way of why the minors are getting in. So what and when should we be watching for? Minors may be familiar or friendly with persons working in the Sunbed business operator premises. So they maybe end up being friends, or they may be friends of friends, so they know how to get in. And often ID is not asked, so they just off they go. There are some premises that are cashless premises. Minors have their Revolut cards. It allows them to tap and off they go. They don't need a credit card where they have to be X age. They have their Revolut cards and they can tap. Also the pay-as-you-go premises, it's no fuss, it's easy to pop in. It's €1 or €2 per minute. So it's not a huge taking from their money that they might be given on a weekly basis. Also Sunbed businesses have top-up cards, so it's easy to pop in for a tanning session from franchise Sunbed premises, so they can go from area to area. So it's quite flexible. So just keep an eye on watching, Sunbed premises. Watch for the minors waiting outside or near Sunbed premises. That's always a sign that why are they all hanging out there, do you know? Watch for Revolut transactions. If you are a parent or a guardian, you will see the Revolut transactions popped up on your phones for the accounts you've created for the minor. Also, the shop's name will be identified on every transaction, so that's another way of identifying why are they over there, why are they in town when they said they were going to Dundrum or Leafy Valley or wherever. What were they doing there? And what's that shop? Watch for emails if they're creating accounts. Watch for these activated emails coming in or popping into emails. So that might be another alarm bell. Watch for their skin, burnt skin, peeling skin, blistering skin, especially in times when there's no sunshine. Why are they getting burnt skin? So that's another thing just to keep an eye on. And also, most importantly, especially during the summer months, there's festivals, there's concerts, there's discos, there's holidays. Minors go weeks beforehand to build up a base tan. So just keep an eye on those events that they're all excited to go in their pairs and with their friends. Just keep an eye on those ones, because that's when they're all then potentially going in 2 or 3 weeks beforehand to build up the base tan. And that's the end of my presentation. So thank you so much for listening to me. And if you have any questions, you can ask me at the end. Thank you.
Thank you very much, Selena. Our next speaker is Dr. Alison Owen. So Dr. Owen is a lecturer in health psychology at Staffordshire University. After completing her undergraduate degree in psychology, she completed a master's in health psychology and subsequently a PhD investigating the impact of appearance-focused skin cancer prevention interventions. She then began working as a lecturer at Staffordshire University, combining teaching with her passion for research. Her main areas of interest and expertise are body image and health promotion, and she has authored over 30 peer-reviewed articles. And today Alison will be presenting on the psychology of sunbed use and the potential for addiction or tanorexia.
Okay, hi everybody. So as they've just said, I'm Dr. Alison Owen, and today I'm going to be talking to you about some research regarding the psychology of sunbed use, so why we use sunbeds, and also research around tanning addiction, and then finishing off with some ideas of how we sort of might help reduce sunbed use. So next slide, please. So just to give you a little bit of background about myself. So I carried out a master's in health psychology in 2009 and 2010, and that's where my interest in research sort of related to sunbed use, to sun protection, UV exposure began. And for my dissertation for that, I carried out focus groups, just sort of talking to people about their sunbed use behaviours, and thinking of ways in which we could improve that. Leading on from that, I then carried on researching and carried out a PhD. As it says here, the title was an appearance-based intervention examining the effect of electronically aged photographs of the face on sun exposure attitudes and sun protection intentions. So I'm going to talk a little bit later in my talk about what exactly I did for my PhD. But yeah, so since finishing my PhD, as the introduction said, I've carried on working as a lecturer and doing lots of research. And it says here, publishing various pieces of research in the area of sunbed use, sun protection, and sun exposure. So what I'm going to be doing today is just talking you through some of the research that I carried out that's sort of relevance to what we're thinking about and talking about today, and talk to you about some other pieces of research that are also of relevance. So if we could move on to the next slide, please. So yeah, what I'm going to start by having a think about is the psychology of sunbed use and tanning. So having a think about why people use sunbeds. So could we have the next slide? So a piece of research that I carried out sort of during my PhD was where I carried out research talking to different people who used sunbeds and you sort of enjoyed having a tan. Of the 70 female participants I interviewed and sort of carried out questionnaires for me, 20% of them had used a sunbed in the last month. And when we looked at all of the participants as a whole, 80% of them agreed that a tan looked good, and nearly 3/4 of them felt that tan people look healthy. So as we've seen from the other speakers so far this morning, actually tan skin isn't really a sign of healthy skin at all. It's actually a sign of our skin sort of trying to protect itself from further damage. So it's quite interesting that, as it says here, nearly 3/4 of people actually felt that people with a tan looked really healthy, and that 80% of them agreed that a tan looked really good. So next slide, please. So I'm a qualitative researcher. So what that means is that when I do research, what I do is speak to people. So I'll do interviews, I'll do focus groups. So the data that I collect from my participants is in the forms of written word and quotes. So what I'm going to talk you through on the next few slides is just some examples of quotes of people that I've interviewed or carried out focus groups with in the past. So this particular piece of research that I did was with British adolescents who were aged 11 to 14. And I was just basically talking to them about their attitudes towards tan skin, towards sunbed use. Got a few quotes here. The participants that I spoke to, as I say, they were between 12 and 14. They had really positive attitude towards tan skin even at that age. So we can see Ellie said, "You don't want to be dead pale." Zola said, "I hate how I'm so pale." So really, even at that young age, they're still sort of, looking at the color of their skin and thinking, nope, I want to be tanned. I don't like being pale. When we were speaking to them about sunbeds, actually I thought quite a high percentage there, really. 15% of the participants had sunbeds in their own homes or had relatives who had them in their own homes. So quite a high percentage, in my opinion. We've got a quote here that was from Virgil, who said, "No, I've not used one, so not used a sunbed, but I think they're very good. It's better to get a proper tan than use sort of sunless tanner or fake tan." So again, quite interesting, even at the age of 13, sort of starting with that positive attitude towards using sunbeds. Of the participants in this study, in the focus groups, there was 227 participants altogether, and about half of them were in focus groups. And I would say, I think it was about 15-20% of them had really positive attitudes towards sunbeds at that age. The rest either had a negative attitude or were neutral. But still, surprisingly high percentage, even at the age of sort of 12, 13, 14 years old. So we can have the next slide, please. So similar sort of study. This was looking at awareness and attitudes of sun risks and sun protection behaviours in a group of girl guides. So they were aged between 12 and 18, the ones that we interviewed. And again, really, really positive attitudes here towards tan skin. So we've got Faith, who's only 12, saying you get more attention if you're tanned. Millie saying it makes you feel better about yourself. So again, really sort of seeing it in that positive way, sort of attention, making you feel better, more confident about yourself, not wanting to be pale. Big thing when we look at reasons for using sunbeds, wanting to have a tan skin is, as Amy's quote here says, those sort of social norms. So what are the people around us doing? Are the people around us using sunbeds? Are the people around us, having tan skin? So we can see Amy said it's becoming like a social norm that you want to have a tan or that you should have a tan. So for her, she felt that, having a tan is something that other people had, and it was something that she felt pressure that, she should have one. Another really big thing that comes up in a lot of research in all different areas, but that I found really comes up in sunbed use, sun protection behaviours, is social media. So we've got a comment here from Blair who said, social media cultivates everything, like from your body type and body image and skin tone. So like all these social influencers and celebrities are all tanned and flawless. So a bit of a comparison there to people on social media, to these influencers and celebrities. And Blair feeling that actually when she looks at these people, on screen or on a phone, they've all got really, really tan skin. We've got Jess here who says, on Instagram and YouTube, there's always people with tans talking about holidays and this will look good with a tan, and say they didn't tan enough on holiday, they want to be darker. So again, linking to that impact of social media, seeing what other people are doing, both in terms of our friends and our peers, but also in terms of influencers and celebrities. If they're there with tans and like sort of, talking about things like tan skin, talking about how they didn't get tanned enough on holiday, then it's really adding to that pressure of sort of feeling like we should look the same and should have that tan skin rather than be more pale. So next slide, please. So a study here isn't one that I carried out myself, but it was a colleague of mine, Jennifer Taylor, who carried out this study. And she interviewed people who used sunbeds. So she was interviewing adult women. So obviously there's studies I've mentioned before are more on younger women, but just to add in some from adult women. So Laura here is just explicitly saying what we sort of think of when we think of why people use a tan. So she said, I think the main reason is for appearance. I doubt anyone goes to the sunbed thinking I need to top up my vitamin D. Actually, though, from my research that I've done with people who use sunbeds, I've found that for some people that is a bit of a justification that say, well, do you know what? We don't get any sun in this country. We're meant to get vitamin D, and actually that's my way of getting it from the sunbed. So that's sort of justification. But as we've heard from the previous speaker today, actually that's just sort of a bit of a myth. And it's not like you would go on a sunbed to really help increase your vitamin D. Interesting quote here from Zoe, and again, linking with quite a lot of stuff that I've found, that sort of justification as to why they're using a sunbed. So Zoe's basically saying in this quote, I do know, there is a risk for something like that, but then I always think that everything's a risk nowadays. They always say, if you do that, you can get cancer. And I always think, everyone does something, like some people smoke, people drink, eat fattening foods and don't exercise. And, I try. I don't smoke at all. I try not to drink a lot. I always think that everyone's got their own guilty pleasure, and mine is going on a sunbed. So that sort of justification is something that I've come across quite a few times in my research, that with people saying, yes, I might use sunbeds, but actually I don't drink, I don't smoke. I've also found that in my other research. So I do research into other health behaviors. So I do research into people who binge drink. In the past, I've done research with smokers. And really is exactly the same. That sort of justification, trying to justify it to yourself. Yeah, I may do this one behavior that's not very healthy, but actually the rest of my life is so healthy and that's absolutely fine. But again, as we've seen from our previous speakers today, even if you don't do anything unhealthy, using a sunbed obviously is still, really risky to your health. Another quote here from Natalie that again is something that I've come across is people sort of justifying the use of sunbeds for health reasons. So Natalie talks about how she's tried topical lotions, antibiotics, tried lots of different things for her eczema, but actually nothing's cleared it up. And so for her, she feels that using a sunbed is the only thing. So a few different reasons on that slide as to why people use sunbeds. As we've seen, we've got those sorts of, simple appearance things, people not wanting to look pale. We've got impacts of social norms, social media, and also people trying to justify it for health reasons. So things like for getting vitamin D or for skin conditions. Next slide, please. So a bit of an interesting study here, I felt. So it was a study that I carried out with a guy called Aaron Blashill. So he works at Harvard Medical School in America. And what we did was sort of take this data from, as it says here, 1,500 US participants. And what we did was had a look at skin cancer risk in comparison to appearance evaluation. So a massive area that I do research in is body image and how people feel about the way that they look. And we found a really, really interesting finding, I felt, in this study. that was that people who negatively evaluated their appearance, so people who felt more negatively about their appearance, people who, when they looked in the mirror, didn't like what they see, were actually at significant increased skin cancer risk. So, as it says here, they spent more hours spent outside without protecting their skin from the sun. They were much less likely to use sunscreen and sun protection. So quite an interesting finding that people who feel more negatively about themselves are less likely to use sun protection, more likely to have been sunburned. We didn't specifically look at sunbeds in this study, but going on these findings, there would possibly, I would presume, maybe be a link between people using sunbeds and people sort of negatively evaluating their appearance. A few different reasons for that. It could be that if you don't feel good about your appearance, you want to maybe try and improve it from using sunbeds, or it might be that actually if you don't feel good about your body and your appearance, you don't care about it and think, well, do you know what, if I get skin cancer, I get skin cancer, I don't care about my body. So quite interesting finding there. So next slide, please. So sort of another study kind of related to this is a study that I have published recently with a guy called Manpal Bogle, and he's an evolutionary psychologist. So we basically were just chatting and realized actually there was no research that was sort of looking at sunbed use from an evolutionary point of view. So with evolutionary research, a lot of it is to do with mate value, which in other words just means sort of how people feel that they, you know, how much value they hold as a potential partner to somebody. And it says here, we found that people who have a higher self-perceived mate value, so they felt that they had more to offer a potential partner, had more negative attitudes towards sunbed use and were less likely to use a sunbed. Whereas those people who felt they had less to offer a partner, less to offer somebody, were significantly more likely to use sunbeds. So again, quite an interesting finding there. So next slide, please. So what I'm going to do now is move on to tanning addiction and just have a little few slides. I know we're running out of time here, but having a few little slides here about tanning addiction. So next slide, please. So as it says here, there's sort of a growing body of research providing just preliminary initial support for viewing excessive tanning as a behaviour with addictive potential, but it's not actually currently recognised as an official behavioural addiction. In the past, when people were looking at tanning addiction, they were sort of comparing it and using traditional substance dependence criteria, so criteria based on things like drug addiction and alcohol addiction. And they sort of don't fit in that well together. But actually, there's more sort of a body of work and a body of research trying to put forward that actually tanning is an addictive behavior and sunbed use is actually really addictive. So next slide, please. Got an interesting study here from Harrington et al. In 2012. So we can see the pictures. These are just pictures of sort of brain scans, and these were pictures from the actual study. And what they did was they took sort of a group of sunbed users and looked at their brain activity and blood flow, sort of brain blood flow, while they were using sunbeds. And actually, they found that, I've got this little quote here, using tanning beds has rewarding effects in the brain. So people may feel compelled to persist in the behavior, even though it's bad for them. Because they found that actually the brain activity and blood flow in their participants while using sunbeds were really, really similar and setting off sort of, you know, similar parts of the brain in people who had drug and alcohol addiction. So a really sort of quite important study here showing that despite maybe tanning addiction not fitting into traditional addiction, you know, molds, actually when we look at the brain activity of people who use sunbeds a lot, they do show the same sort of reward centers, the same blood flow as people who are addicted to drug and alcohol. Next slide, please. Just got this little measure here, which I thought was quite interesting to add in. So this was made by Stapleton et al., who's a massive researcher, psychology researcher in sunbed use. And he's developed this behavioural addiction indoor tanning screener scale. So it's 7 items. And if someone answers yes to 2 or more of those items, then it suggests a possible addiction to indoor tanning. So next slide, please. So just to finish off, obviously, we've looked at sort of the reasons why people might be, you know, wanting to use sunbeds, wanting to have tan skin. And we've looked at the possibilities of tanning addiction. What we want to do next is think about what could we do about that? So as we can see from here, we want to try and think about changing behavior. So as I put here, health-related campaigns can often fail to motivate young people to change their behavior. So if you think about things like smoking, We all know that smoking is bad for our health, but that doesn't mean that people, choose to stop smoking. They still choose to continue smoking. Researchers found that many people feel that actually health-related threats are too long-term to sort of worry or concern, and they're not relevant to them. But as it says here, research by Sarah Grogan, who does a lot of research in body image, found that for a lot of young people, they're highly motivated to maintain a youthful appearance and that their appearance is a priority for them. So she carried out research with young smokers, and they basically were all saying, do you know what, I enjoy smoking. It's not something that I'd want to give up. I know it's not great for my health, but actually at the moment, I'm not seeing any impact of it affecting my health. Maybe if I started with a cough in the future, I'd stop. But what they did say was that if the smoking started to impact the way they looked, that might be what would stop them and make them think about stopping smoking. So next slide, please. So do you want to just click through a couple of times? That's it. So we can see from this slide, this is, I know one of the speakers touched on it earlier, but this is a piece of software that I used in my PhD. And it's basically a piece of software that shows people how they'll age with and without using some sunbeds, or with and without protecting their skin from the sun. So we can see the photo on the left-hand side of the screen is our natural intrinsic aging. So obviously, however well we look after our skin, we're all going to get older, we're all going to, age our skin. However, the photo on the right shows the extrinsic aging, so the added factor of using sunbeds. And we can see the difference between those. That's me aged at 72. We can see more wrinkles, more sort of sunspots and age spots. So what I did for my PhD was use this software on people between the ages of, it was 12 and 34, just to see what kind of impact they felt it might have on their future sunbed use. So if we can just click through to the next slide, please. Oh, that's it, click a few times. So I've got a few quotes here, I'll just talk through a couple of them. So when we showed people that software, they had really sort of positive responses to it. Got a quote here from Georgina, who said, if you sort of look in between the two, so she means look in between the one where she's aged using a sunbed and one with just the natural aging, and think that just by making the effort to put some sun cream on and like not using sunbeds and stuff is going to stop that, then definitely. If with the young people, we can see Bruce, for example, saying it's maybe you want to use more suntan lotion, plaster it on before you go to school. So touchwood, really sort of potential for interventions to help people, and using sort of appearance concerns to maybe try and encourage people to choose safer sun protection behaviours. So if we just move to the last slide so I can quickly finish off, please. So just to conclude, we can see people use sunbeds for a variety of reasons, not just appearance concerns, but also things like social media pressures, social norms and people around them. There is definitely a risk of becoming addicted to sunbeds, and research has found that using sunbeds can sort of have that addictive quality. And what we want to be doing is developing interventions to reduce sunbed use and encourage safer UV exposure behaviours. Thank you for listening.
Thanks very much, Dr. Owen. So we're going to take a quick break now for 5 minutes. So the webinar will recommence at 11:10. Welcome back, everyone. Our next speaker is Caitlin O'Leary. Caitlin started using sunbeds from the age of 14, and Caitlin, who is now 19, is keen to share her personal experience. So she chatted to Maria McHenry, Cancer Prevention Officer with the NCCP, in advance of today's webinar.
So today we're joined by Caitlin, who is going to share her personal experience of using sunbeds previously. So Caitlin is now 19 and had used sunbeds when she was younger. So Caitlin, do you want to just start off maybe and let us know how you started getting into sunbeds, or why you got into them in the first place?
Yeah, so I started when I was around 14, like as bad as that sounds, like it's so young, but it was so easy to access them. I was using my sister's ID at the time and stuff. So when everyone around you is doing them and it just seems so normal that you have to do them. So that's how I mainly started getting into them. And then when I was going through like my teenage years, I did suffer with acne. So when they started clearing me spots and stuff, that's how I started getting really into them. Because I seen them, like, they were clearing my face up, so that's what worked best for me. So that's how I started really getting into them. And then along the years, I just couldn't stop them because I started gaining the colour, started feeling better, looking better and stuff. So it was just so hard to stop once you started, like, with them. So that's
and
how
often would you have used sunbeds? Like, would you have started off using
when I
them?
started off, it would have been like, my parents wouldn't have known, so it would have been like whenever I could have gotten money, so probably maybe 3 times a week. But as the years went on, I started my own job and stuff. I was doing it 5 days a week, like anytime there's some bed shop would close on a Sunday, and I'd be panicking that I wasn't getting my last sunbed in for the week. Like, I was doing them nearly every single day. Like,
and what then made you, I suppose, give you a little scare and I suppose stopped you from using the sunbeds?
So I've been told my whole life, everyone in my family, like no one in my family would use them, and been told my whole life they're bad for you, they're this and that. But when you're in the moment and you just think like, it's not going to happen to you, you don't worry about it. Then in January, so I was on the list for a dermatologist for 2 years. I just had a little cyst on my chest. It was nothing to worry about, but I just wanted it removed. So I finally got my call then, after not even thinking about skin or anything like that. It was more so going about my cyst. I went then to a dermatologist in Hospital in January just gone, and in February. And when I went, he had seen how tan I was and stuff, and he had asked me how long I've been on sunbeds, just asking questions, and I told him. And when he realised how long I was on them, he was saying would I be comfortable with doing it like a full body mapping. So at the time I was like, that's no problem, like I'm there anyways, I might as well get it. So then when I was there, he had found then one on my back, and then I ended up getting that removed, and I came back as precancerous. And then I had went back then just for a checkup about my scar and stuff like that. And then this was only 3 weeks ago, then they found another mole just below my belly button. So that's 2 in the space of 3 months basically. And like, I would have never ever feeling this way about sunbeds ever up until now. Like, nothing could have changed my mindset back then, but now I'm like, I can't believe like I actually went that long without feeling anxious around about them. But now, like, I'm just so glad that I'm completely off them. Like, I'm so glad it only it happened while I'm still young as well. I'm not going more years down them and stuff like that.
And
So,
what message would you have, say, maybe to someone your age or younger who's maybe thinking about using sunbeds or has started using sunbeds?
just stay away, get out as early as you can from them. Like, I know I'm on them a good few years, but I'm so lucky that I did stop when I was like 19. I could have got a lot more years. Like, just don't go with the crowd, just stop doing them. Bottle tan is better. It's just not worth it in the long run. Like, you might not get anything, you might go see a dermatologist and everything is fine, but in the long run, like, it does catch up with you. It's not worth it.
Yeah, and I think that's what a lot of people think, that the skin cancer side of things won't happen for a long time down the line, or it may never happen. But I suppose it can happen to young people. I suppose the more frequently you use sunbeds. Yeah,
definitely. Like, it will, like, more than likely eventually happen, and I'm just glad it did happen when I was younger, so that I'm not getting scared to like fully stop them then.
That's great. Thanks very much, Caitlin. I don't know, is there anything else that you wanted to say or any other message you wanted to give to anyone? I suppose we have a lot of young people that we're concerned about who are using sunbeds and maybe the Melanotan injections and nasal sprays. So I suppose highlighting the aging side of things is something we're trying to do, as well as
Yeah,
the danger of
definitely.
skin cancer.
I would have never worn sun cream, and now like that's all I think about is wearing sun cream even on days like this when it's not hot out. Like, it's so important for your skin and even for your looks down the long, like the long term. You might look good with a tan, but in the long run it's not going to be like that. You'll be like, it's not worth it, definitely not.
Okay, thanks very much, Caitlin, for taking the time to chat to us today. I'm sure your message will, I suppose, reach a lot of young people and hopefully highlight the dangers of sunbeds and how it can actually impact you, and it can accumulate the damage to your skin as well. So thanks very much.
No problem. Thank you.
Thanks so much to Caitlin for sharing her story with us. Our next speakers are Lauren Dwyer and Sarah Boyd. So Lauren, who is a student at TU Dublin, and Sarah, who is a lecturer in food science and environmental health, and Lauren's project supervisor, will share their presentation on nasal sprays, an emerging issue.
Hi everyone, so my name is Lauren Dwyer and I'm a final year environmental health student who has just recently completed the environmental health course in TU Dublin. And as part of our final year, we are required to carry out a research project. And for my research project, I chose to do an investigation into Melanotan II products and their accessibility in Ireland, with a specific focus on the Melanotan II nasal sprays. I chose to do my final year project on this topic because I noticed that the Melanotan II nasal sprays were kind of a growing trend, and I found that I was kind of getting ads for them on social media, and I knew of people in my local area that were using the products, and I just seen kind of an uptake in use of these products, and I was curious as to what the products are, where people are buying them from, and what was in them. So because of this, I chose to do a chemical analysis of Melanotan II nasal sprays in the TU Dublin labs, where I carried out HPLC testing on samples, and I also carried out a desktop audit on online sellers and retailers of Melanotan II products, which I'm going to share with you today, and just share some general information in Melanotan II nasal spray products and what to look out for in that as well. As it's a growing area of concern, and as I mentioned earlier, there is like an uptake in use of the product. So with that, I'm going to share my presentation, which is today. The title of my project is A Chemical Analysis of Nasal Tannin Sprays and an Assessment of Melanotan II products and their availability in Ireland. So just an introduction, what is melanotan? So Melanotan II is an unregulated form of alpha melanocyte stimulating hormone known for darkening human skin. So Melanotan II does this by mimicking natural hormones that we have in our bodies known as melanocortin peptides. And these hormones are involved in the production of pigmentation in the skin, known as melanogenesis. So Melanotan II, being a synthetic hormone, kind of stimulates the production of melanin in the skin, and stimulates melanogenesis. So melanotan was initially designed to treat patients with photosensitivity disorders to light, such as albinism and EPP. However, this isn't an approved substance. So melanotan isn't approved to treat or cure any condition within Ireland or the EU. So Melanotan II is classified as a medicinal product, not a cosmetic product. As by definition, a cosmetic product can't be inhaled, ingested, or injected, which Melanotan II requires for uptake of the product. So Melanotan is available in injectable form, nasal spray form, oral drops, drinks, and gummies. So the injectable form, the tannin injections were kind of more popular around the early 2000s, but they're not really used as much anymore, and nasal sprays are kind of more popular. And this can be seen kind of in trends on social media, on Instagram, TikTok. And the nasal sprays are relatively new, kind of came in around 2022, is when I seen a huge kind of increase in advertisements and marketing of the products on social media. And these products, they're kind of they're more discreet, and they can be kind of hidden in handbags or gym bags. And they don't involve injecting as opposed to the tannin injections. So I suppose in that regard they're easier to use, as they can be kind of easily hidden, they're easily accessible, and they kind of work the same way as the tannin injections do. So they're advertised to be used in conjunction with sunbeds and or natural sunlight, and this is to activate the melanotan and stimulate the melanogenesis, causing darkening of the skin. So side effects of Melanotan II, so increased pigmentation and skin and nails. This is kind of the main sought out for side effect really. So people typically use Melanotan products to darken the skin. And you can see in the picture on the right there, it shows a young girl kind of using the product. This was on a TikTok video, and I took a screenshot. So a nasal spray a day keeps the pellets away. That's the caption of the video, which is kind of, it's ironic really, considering it's a twist on the phrase an apple a day keeps the doctor away. But it shows a young girl using the product, and that is how the product is kind of used. It's inhaled through the nose, as the girl is doing in the image. So headaches, darkening of moles and freckles, and the development of new moles and freckles, which again is quite concerning, as kind of noticing any change in any existing moles or freckles or the development of new moles and freckles is something that should be kind of monitored by your GP. And using these products, knowing that this is a potential side effect, it's dangerous, and it could potentially end up leading to something more sinister. Vision loss, facial flushing, loss of appetite, which is commonly advertised as a benefit of using the product on social media platforms and sellers kind of websites, as loss of appetite leads to weight loss. And a lot of the kind of sellers use this as like a vantage point, as a means of kind of advertising, you might be tanned and you also might lose weight, which is it's very harmful, especially considering that the target audience for this product is predominantly young females, and this could cause a lot of kind of unhealthy lifestyle choices. Gastrointestinal symptoms including diarrhea and vomiting, spontaneous erections, rhabdomyolysis, which is the breakdown of muscle cells, and this can permanently damage your heart and kidneys, and kidney infection. So this is a lack of blood supply to the kidneys, which can lead to necrosis, and then ultimately leading to renal dysfunction or renal failure. So this slide will go through a kind of case study of a lady. So the lady in the image there is Sarah Ashcroft. She is a young mother from Birkenhead in the UK, and Sarah was diagnosed with actinic keratosis, so it's a precancerous condition, as a result of using nasal sprays and sunbeds over the course of 9 years. So Sarah was told her precancerous condition was caused by years of using nasal sprays, which together with sunbed use effectively doubled the amount of skin damage that she received. So the doctor looking after Sarah had kind of said to her that the use of sunbeds and the Melanotan nasal sprays actually doubled the amount of skin damage that she received, which is quite scary to think of. So Sarah quoted, "Over the last 9 years, I've been using tannin injections and nasal sprays. It's all down to sunbeds and using nasal sprays. People don't realize just how dangerous they are. It's been a reality check for me. I know so many young girls who use nasal sprays. Years ago, it was tannin injections, but you don't hear much of them now as people are using the spray and they're going on the sunbed every day." So Sarah acknowledges here, you know, some of the trends that are kind of occurring, like the change from tannin injections with the switch to nasal sprays. Again, it's likely due to the convenience of the product. They're easy to use, as opposed to injecting yourself. They can be easily hidden in bags. You know, and again, it's a lot of young girls using them, and then they are going onto sunbeds every day and using them in conjunction with tannin, kind of natural, using natural light or sunbeds. And this is causing skin damage. And unfortunately, Sarah, here in the images, she had to undergo a painful treatment, which she said left her skin feel like it was burning. And this kind of shows the reality of using these products. And it's important that, you know, as I'll show you images throughout this presentation of how the product is marketed, and it looks, you know, it's marketed in a way that makes it look quite aesthetic and nice, but this is the harsh reality of using Melanotan products and sunbeds. So why is Melanotan an issue? So Melanotan II products are unregulated across Ireland and the EU. So it kind of raises the question, what is actually in the products? Because they can't be legitimately manufactured in laboratories within Ireland or the EU. So I got this quote from the Health Product Regulatory Authority's website. So and it was Grania Power who stated, "There is no data to support any safe use in any form, and anyone using it is taking a huge personal health risk." And this was in relation to Melanotan II nasal spray products. So again, they state Melanotan II is not an authorized medicine, and it's not possible for people to obtain it from a legitimate source. There's little information on the safety of these products and what they contain or how or where they're made. So where is it being manufactured? So again, the source is unknown, as there's no legitimate sources manufacturing the products. So there has been links to China. An example of this was seen in the USA by Melanocorp Incorporated. This was a company who were selling tannin injections and nasal sprays a couple of years ago. And what happened was the owner of the company was advertising his products as 100% manufactured in the USA. So the FDA, you know, after warning them not to be selling the products as they weren't FDA approved, you know, they did a deep dive and they actually discovered that the products were being shipped in, imported from China, and he was rebranding them and relabeling the products as 100% manufactured in the USA and selling them. So the owner of that company was actually charged with false claims on a product, and also charged for selling a product, an unregulated product, but also for shipping it into EU countries. So you can see here at the bottom, there's a screenshot. So a lot of companies selling the products make claims regarding the purity that Melanotan II is sourced from a lab. So the quote there, "At Fast Ham, we only source the highest quality Melanotan II straight from the laboratory. All of our Melanotan II is purity tested to ensure we only sell the best." So this is taken from a Northern Irish seller, and the company is Fast Nasal Tanners. And they're stating that they are getting their Melanotan straight from the lab, and that the Melanotan II is purity tested to ensure we only sell the best, which it's quite misleading to consumers because, as I mentioned in the previous slides, this product can't be legitimately manufactured. So I wouldn't exactly, you know, it's not fair to say that the product is purity tested, as it's unlikely that this is the case. So this is just a few screenshots that I took from Instagram accounts from Irish sellers of Melanotan II. So I just added these in just to show how the product is marketed. So again, it's predominantly marketed towards young females, and this can be seen in kind of the advertisement and the language used, the name of the brands, the like the aesthetic of the brand. So as you can see in the bottom though, I just like to highlight on this slide. So Divine Tannin and Tannin by Smith, or Smith's Tannin, they both have approximately 4,000 followers, which is a huge amount of followers. you know, just like and most of these followers are young females. But it's just to highlight these are two Irish brands, and both operating from Dublin. They both offer collection and kind of shipping of the products as well. And you can see in some of the photos there that I've added, they offer bulk bundles, and the top photo, the top left photograph there that you can see, says, warning, opening this package will cause extreme happiness. Which again, there's no label on the bottle itself, you know, any side effects, any ingredients, even a best before date, or you know, just even a label to say what the product is. So yeah, it's quite scary, but I added this slide in just to kind of show and highlight how the product is marketed and kind of highlight who it's marketed towards, which is predominantly young females. So where are they coming from? There's bulk offers available online, where a brand might operate almost like a pyramid scheme, where they're selling, you know, kind of 10 nasals. This can be seen in the image on the left, but they're selling 10 nasal sprays for €80. And then they're advertising that you can make €450 off of this, by you selling them for about €45 each. You know, and as you can see, they're kind of incentivizing purchasing higher quantities to make profits. So 200 nasal sprays would cost €360, but they're saying that you could make over €9,000 by doing so. These products are sold unbranded or labeled, so that the wholesalers or the people buying these bulk bundles can add their own logos. So again, this is concerning because, you know, there is no ingredients list, no best before date or nothing like that on the packaging itself, and it kind of gives sellers free rein to kind of put whatever they want on the bottles as well. And again, Divine Tannin, it's an Irish supplier, and there are Irish suppliers selling bulk bundles, and it's a common theme across a lot of the social media platforms for these sellers, where a lot of them do actually offer a bulk bundle offer. So how is Melanotan II sold? Online websites, social media, which is kind of the main source or the predominant sales platform. Sunbed shops, which are they wouldn't exactly be out on the counters in Sunbed shops. It would kind of be more of an under the counter thing. And from my research, this is what I found. It's a lot of kind of the staff who work in the Sunbed shops would sell them kind of as a side business for themselves, as opposed to selling them directly through the Sunbed shop. Gyms, so again, one of the kind of target audience for these products are bodybuilders and gym goers, and this is because of the suppressed appetite or lack of appetite, and the tannin kind of effect that they have. So for bodybuilders, this is kind of ideal as prior to a competition. You know, they would tan themselves up and they want to look as lean as possible. So as part of that lifestyle, they'd cut, which involves eating significantly less calories and less food, in order to make themselves look more toned and defined. So sellers predominantly operating through social media accounts, using private accounts and personal accounts. So it is actually quite hard to quantify exactly how many sellers there are operating in Ireland. Like it's unclear because, you know, people aren't exactly selling them, you know, the pages aren't listed as Melanotan II or nasal sprays. Some of them could be just listed under John Doe, you know, and they might be selling them just through their personal accounts. And that's, you know, you'd kind of need to have a little bit of street knowledge in order to be able to fully assess how many sellers there are of Melanotan II. And the sellers tend to use false information and make false health claims on the products. So I've added a few screenshots there, and I just I don't want to spend too much time on this, but I'd just like to draw your attention to the top right screenshot there. So it's a disclaimer, but in the disclaimer, hidden away, it states this product is intended for research and medical purposes only. On the very last screenshot as well, on the very end sentence, this product is intended for research and medical purposes only. So this is kind of constantly seen throughout the on social media and on websites, that the like, you know, in the disclaimer section, which is quite scary because it's hidden away there, and again, it's not clear for consumers what that is or how that is, because they're also saying that you should use them in conjunction with Sunbeds and then stating that they're for research and medical purposes only. So as you can see in the screenshot in the middle there, you know, improved fat loss. Melanotan helps metabolize both visceral and subcutaneous fat and may help boost weight loss efforts. So again, it's a false health claim on the product, and it incentivizes kind of reduced appetites and using the product as a means to lose weight as well. So this image here just shows you the different types of Melanotan products available. So the nasal sprays, which are the most popular, the tannin injections, the gummies, Melanotan drinks, oral drops, face drops. And all of these products in this picture are sold by a supplier in Dublin. So that's Divine Tannin. And you can see some of the prices are listed there for the different bundles that the seller provides. So they're relatively cheap. Kind of they range between 20 and €50. So again, the types of Melanotan. So Melanotan drink contains 60 milligrams of Melanotan II per bottle, which is quite shocking because this is the highest quantity of Melanotan II I've seen in a product. So the instructions for use state that to take 3 sips 30 minutes before a sunbed or outdoor tanning, which is quite vague, because if everybody on this call was to take a sip of their water, 3 sips of their water, I guarantee the quantity would be completely different for everybody. So this, you know, it's so vague and it's so dangerous to advertise or to, you know, this kind of lack of information with these products, and you know, it's especially with the dosage. And I'll discuss now a case report of a 39-year-old male who injected 6 milligrams of Melanotan that he purchased over the internet, which was 6 times the starting dose, and this resulted in systemic toxicity with rhabdomyolysis and renal dysfunction kind of symptoms of that. And that's 6 milligrams as opposed to 60 milligrams that's in the drink. So it'd be quite easy to overdo it because of the lack of instructions as well. So this slide will just go through some of my findings from the desktop audit. So all of these graphs go through, they cover data gathered from 10 different sellers across websites and social media platforms. So the first, the top left graph there goes through the number of selling platforms that listed potential side effects of use. So 80% of sellers didn't list any side effects of use, which is shocking. And the number of sellers that provided Melanotan II products other than nasal sprays. So 90% offered another type of Melanotan product, with only 1 or 10% offering exclusively nasal spray products. So this could be the tannin injections, the drinks, the gummies, anything mentioned throughout this presentation. The number of websites that provide explanation of how the product works. So only 60% provided an explanation of how the product worked, with 40% providing no explanation. And it's important to note that just because they provided an explanation doesn't necessarily mean it's factual. It was just that they gave some sort of description of how the product works. So for example, they might have mentioned that the product stimulates melanin production. So, and then the last kind of chart there shows a comparison of the different price ranges from the different sellers. So the lowest price there was €23.20, and the highest price of €46.99, with prices kind of varying in between, that can be seen there on the chart. So again, relatively cheap and accessible for young people to purchase the products. So what to look out for: discreet packaging. So again, the bottles are quite small. They can be put into bags, gym bags, handbags, They're kind of discreet. There's no labels on the bags or the packaging. They're sold in bags that might hide the product, that can be seen in the top image on the left or the right there. There's little to no information on them. So again, no labels or anything kind of written on the packaging or on the bottle itself. And an excessive tanned complexion. So people who use Melanotan II products tend to have an excessively tanned complexion. You know, people who use Melanotan II and Sunbeds do tend to be quite dark. And it is concerning, but it does stand out, and the tan itself is quite obvious. And as mentioned previously, one of the kind of side effects is facial flushing. So people who use the products tend to have a red kind of hue off their skin, kind of making it a little bit more obvious than kind of people just using Sunbeds alone. The Melanotan itself does have kind of a very distinct tan. When people are using it, you can tell. So thank you for listening. And if you have any questions, you can contact myself, Lauren Dwyer, at the email listed below, or my supervisor, Sarah Boyd, on her email. And I'm
Thank you, Lauren. Our final speaker today is Sean Cullen. Sean is an Enforcement Operations Manager attached to the Enforcement Section Compliance Department at the Health Products Regulatory Authority. And today Sean is going to present an overview of Melanotan II.
Hi, everybody. Sean. Hi, everybody. So my name is Sean Cullen, and I'm the Operations Manager here in the Enforcement Section of the Compliance Department at the Health Products Regulatory Authority. The Health Products Regulatory Authority is the national competent authority for the regulation of medicines, and every European country at the moment has a competent authority. So we basically regulate medicines, cosmetics and medical devices, and veterinary products. So our enforcement section here primarily deals with the breaches of our medicine legislation, which is sits under two acts really as such: the 1996 Act and an updated 2006 Act. So I'll give you a brief overview in relation to what we're seeing. So my first slide is really a history of Melanotan, and it's Melanotan I and Melanotan II. And a lot of our previous speakers have touched on this already, which is great. For me, it is. So I'll talk briefly about why people are using Melanotan II, how much is being sold, what we are seeing from an enforcement point of view, and what's being sold, where it's being sold, and our recent activities in relation to it. So next slide, please. So that infographic now, basically, it'll zigzag down the page. You'll see in relation, it's a very brief history of Melanotan. You see in 1981, Melanotan I was developed, right? And by university in the US, and primarily used to treatment, as a previous speaker, two speakers have mentioned, EPP, which is when a skin gets it's treated with sunlight, it has a huge toxic reaction to the individual. So in the 1990s, you see Melanotan II being developed, and initially in the development of erectile dysfunction problems in males. But it also was found to increase skin pigmentation, and more side effects were noticed in relation to Melanotan I. 2003, they attempted to market a product in relation to Melanotan II, but it wasn't picked up on and was no commercial development, and it all stopped. 2006, you had an authorized version, Skinez, and it was used again in relation to the legitimate treatment of phototoxic reactions from EPP to individuals. In around 2008, we started then at that stage seeing Melanotan I and II being sold online. and then you had warnings in relation to the use of the products, and from the IMP, which is the old name for the HPRA, we renamed back there about 3 or 4 years, 5 years ago, actually, to be honest. And they were noticing like there was huge problems with these products. In 2010, the first product was licensed by the Italians. 2015, the treatment was approved. The product Skinez was approved by the European Medicines Agency, but it's a very high niche medication. Like you could not present a prescription at your local pharmacy in relation to this product. And it was available only in exceptional circumstances, so it'd be really coming out of hospital pharmacies and under the care and treatment of a specialist in relation to that sort of field. Melanotan I sort of went off the scene because Melanotan II was used as a cheaper product, and it was available in other various mediums, the likes of, say, nasal sprays and injections and drops. And it's an easy product to use, and it became convenient in its usage. And you see 2019, again, the product Skinez was approved by the FDA for the prevention of EPP, which is a very distinctive skin disorder, and it's again, it's a high niche drug and only available out of special healthcare sectors, the likes of hospitals, and like authorized private clinics that specialize in the likes of skin disorders. Next slide, please. So really and truly, at this moment in time, Melanotan I has really gone off the scene, and we're seeing Melanotan II. Various names have been used in relation to MT2. It's also known as a Barbie drug. Other speakers have mentioned the fact that it would sort of, as a sidebar to the use of it, you have a loss of appetite, and it reduces, and it's purely from a point of view of a loss of appetite that you have this sort of weight reducing effect. Also, the fact that it had a sort of an increase in libido, the likes of the treatment of ED dysfunction in men. So, hence the name Barbie drug. Next slide, please. So, side effects again have already been mentioned and touched on, which is brilliant in previous slides. You have nausea, facial flushing, headaches, visual disturbances, numbness, needle safety. And what we're seeing an awful lot is, you will have a huge, and these are sold in kits. We have seen it sold in powder form with patches of syringes, but there's no information in relation to how do you use a needle, where do you inject it. We know that people are infected or are injecting it in stomach areas. From instructions, you're not really given instructions. A lot of it's just oral from a person you buy it off. And how do I use this? This is what you do. Like, people are filling these vials from the tap, and shaking it and then injecting themselves with it. So there's a huge potential there for microbial contamination in relation to use and the safety around the use of needle safety. Skin cancer we've already mentioned, and skin aging, and like new moles and skin lesions. But like, let me reiterate, there is no instructions given with these, and shouldn't be, because they're completely unauthorized, as has already been mentioned. These are what's called an unauthorized medicine. So there's no such thing as take two and sit back and wait for it. There's no instructions whatsoever in relation to this type of medication. Because it's a completely illegal medicine. It's not authorized. The form that we're seeing, apart from the FDA approval and the European Medicines Agency approval for a particular disorder that's been treated in controlled circumstances, this type of unauthorized medication is off the grid in relation to what you should take it. So when you're reading the blurb in relation, this is what you do, this is what you take. As has been mentioned already, 3 sips and you're fine, doesn't exist. It just doesn't exist. Next slide, please. So from a numbers in relation to what we're seeing, we work very closely with the likes of our National Police Force, our Garda Síochána and Revenue Customs Service. So on a daily basis, we get communication from customs in relation to detentions of medicines being stopped. But things will get through. It's too big, from a point of view of customs, things will fall between the cracks. So it is difficult to quantify the overall detentions. 2016, 2020, detentions were somewhat around 500. But that could be, that was what we were seeing. They spiked in 2023 up to almost 1,400 units, again rising from 2022 and 2021. But in comparison to the overall detentions in relation to other illegal medicine being sold online, unauthorized medicine being sold online, the quantity is still somewhat low. There's a huge consumer demand in this country in relation to Melanotan II products. Again, it has already been alluded to in relation to social media. In fairness to some of the big media platforms, we work with them and they do cooperate in relation to what we're seeing in enforcement here. We sort of have a 3-pronged approach in relation to our investigation of our legislation. So we have boots on the ground in relation to investigators calling to the likes of business premises. We have a huge power of inspection there. We carry out house searches, and we work very closely with customs in relation to what they're seeing, and we regularly collect detentions they have made. So we have prosecuted people. As I already mentioned, they're widely advertised on social media, and we have taken down pages and sites in relation to that. So we're constantly actively enforcing our legislation. But it indicates a worldwide surge of interest in these products, and ever since the likes of the use of, certainly in the last couple of years, probably primarily due to COVID and people spending more time on the internet, we're seeing an increase in the use of TikTok as well. Next slide, please. So what we're seeing is the prices you can see, and it has been mentioned already, we are still seeing the vials, okay? And up to recently, even as recent over the last month, we detained close to 50 vials in the southeast part of the country in a tanning shop. And as I mentioned already, and this was basically underneath the counter. Primarily coming in through the postal system, and it was a little kit that you bought, including your syringe and a small vial of saline solution. Absolutely no instructions whatsoever as to what you should be doing. But again, as I mentioned, there should be no instructions because these things should not be for sale. They're a complete and utter unauthorized medicine. The nasal spray we're seeing, and we've also seen the bottles. Now, some people are of the illusion that these things are coming out of clean laboratories. We have searched houses and found small little manufacturing units in people's bedrooms and in bathrooms and in kitchens where they can buy a quantity of APIs, we would call it, a quantity of chemical, i.e. Melanotan II, and empty bottles and labels, sticky labels, already printed out, or they can get their own sticky labels printed out here, and off you go with a small little manufacturing unit with no thought whatsoever of what am I, how will I mix this? What should I do? None whatsoever, none whatsoever. And we have found them in, as I said, small little manufacturing units in people's bedrooms and in bathrooms. And it's always not the cleanest of places. So when young people are looking at these images, they think this is coming out of a laboratory. It's not. It's absolutely not. And the dangers of microbial contamination is huge, absolutely huge. Next slide, please. Where they're being sold, again, we spoke, other speakers have spoken, it's all over the internet, you know what I mean? A lot of these postings we've redacted because these are local, these are individuals, these are Irish people, and you can see the followers. That's your Facebook, Now, in fairness to Facebook, they're with us on this one. They are with us on this big time. It's constantly to our contrary to our legislation, and it's always it's contrary to their own processes and guidelines themselves. Next slide, please. Again, you see it. You see the images, Instagram images. It's great. I've used it before. It's fantastic. The vials. There is still vials out there. But people have this thing about injections. So yes, the nasal spray is a bit more friendly, user-friendly, if I can use that term, which I don't like using, but you'll find a lot of people will buy it because I don't have to inject myself. I mean, it's ridiculous. I use this, but I don't like injecting myself, you know, absolutely crazy thought, like, you know. Next slide, please. Instagram, huge as well. But in fairness to Meta, they are so good. They are good in relation to it. Next slide, please. So we've updated, the link is there and it's available, I know, after the webinar. We have updated and we are still seeing it. We are constantly monitoring the internet. I'll give you my contact details, my last slide. It's my personal contact in relation to here. So you can see the stats there in relation to ourselves, 463 social media, and for listening to Melanotan containing products where we remove these. And this is happening on a daily basis. We're constantly looking at it. We carry out inspections. And that includes the likes of business premises. And we've worked in conjunction with our other stakeholders, the likes of the HAC in relation to it. So there's something always going on in the background in relation to it. But this is a totally toxic type of, it's a chemical. It's a chemical. And the warnings are there. But unfortunately, it's an issue that we're trying to deal with, and it's a constant problem that we're faced with. Social media is not helping. There's one reported death in the UK, but it is linked also with weight issues as well back in the early 2012s. But it's something young people should not be doing. It's not worth it. Last slide, please. That's my contact. If anybody needs to talk to me or send me a mail in relation to what they see, what they're not seeing, we're out there. And that's what we're here to help. If you see something or you want to talk about something, give us a shout. Thanks very much for your time. I can't stress how serious it is, you know.
Thank you very much, Sean, and thanks again to all of our speakers. So now I'd like to invite all of you back to take part in the Q&A. Lots of questions coming in. So we have a question for Selena. Do we have any data on the number of Sunbed premises that are currently operating in Ireland?
Hi, yeah, we would have, obviously, our software system has all the registration Sunbed businesses that have notified to us. They would notify to us every year, so it's quite up to date and present. So yeah, the number of businesses is registered at the HSE is available.
Okay, thanks, Selena. So a question for Dr. Owen. So in your studies, you highlighted a lot of people know the dangers of sunbeds but still use them. And from your research, what do you think is the best approach from behaviour change when it comes to people using sunbeds? Is focusing on the aging side of sunbeds the only behaviour change intervention that works?
So in terms of the research that I've done, I've mainly looked at the appearance focused stuff. But I have done a few studies where I've compared that appearance focused intervention that I was talking about with health focused information. So basically a group of people, half of them I showed the appearance focused intervention to, so doing it sort of one-on-one on them. And then the other half, I showed just sort of health literature, so about, you know, the health impact of using sunbeds and what it can do for your skin, that kind of thing. And so for that one, I used questionnaires and gave them questionnaires before the intervention, so either the appearance one or the health one, and then a questionnaire after they'd either had the appearance intervention or if they'd read through the health literature. And when we did sort of statistical analysis, we found that actually the appearance focused stuff was much more effective than the health focused stuff. So people who'd viewed the appearance focused intervention were significantly more likely to intend to use sun protection in the future, significantly less likely to use a sunbed. They felt significantly more susceptible to sun damage. So yeah, in terms of comparing sort of health focused appearance, the research that I've done did show that the appearance focus did seem to be much more effective than the health one.
Okay, that's very interesting. And I suppose along a similar lines for Caitlin, so did you find that the scare you had when meeting the dermatologist was the main reason for stopping using sunbeds, or do you think there would have been anything else that would have stopped you from using sunbeds?
No, no matter like what people would have telling me, like it just went in one ear out the other up until I did get that scare. Like it completely changed my mindset. I would never even have a second doubt about doing sunbeds. I always thought to myself, like everyone else that we've talked about, you think it's not going to happen to you until it does. You think that like you'll just take the risk just for a tan. I would have never had the mindset that I do have now if I didn't get that scare.
Okay. And a question for Sean. So it was in relation to, I think, the regulation of the sorry, I just find it here again now. Oh, sorry, is it possible for anyone to buy Melanotan II on its own that can be mixed with other substances and then sold?
It's possible to buy anything on the internet. The thing about Melanotan II is that it's in a completely unauthorized medicine. It's an illegal product. You can buy large quantities of it. I'm sure you can on the internet. You find a lot of young people, budding entrepreneurs, are buying it on bulk and then trying to, you know, divide and mix out to individuals, which we find really scary. But yes, it's possible. It's an illegal product. But you can buy, you know, anything on the internet these days, and especially I won't even go to mention the dark web. You know, you can buy it. You run the risk of me and my colleagues knocking on your door. That's the only problem, you know.
Yeah, it's very concerning. Another question for Selena. You've mentioned that you have minors undertaking mystery shopping. Have you had any prosecutions using this type of inspection?
So mystery shopping isn't for minors, it will be a test purchase. Have we taken prosecutions for this type of exercise? Yes, we have. The HSE has been very successful with prosecutions all over the country. It goes to district court, and there are presently ongoing prosecutions. So we would carry that exercise out at least once every year minimum. So we'd send the minor in, and it's a zero tolerance basically, and the prosecution would be recommended.
Okay,
and
thank
it is
you.
for test purchasing. Just bear that in mind.
Yeah, because they're
Mystery
minors.
shopper is for the other parts of the legislation.
Okay. So another question for either Lauren or Sarah. So a comment came in that tanning injections are very big with the traveling community as well as the nasal sprays. And what do you think is useful when it comes to increasing awareness of this issue at a local level?
I'm happy to come in there. And again, I'm really pleased actually to get that comment specifically in relation to the traveling community, because it really highlights, you know, maybe at local level what the challenges are, and maybe more intervention needs to be done at local level. And I have to say, myself and Lauren, we'd be very happy to meet with certain community groups and maybe highlight, you know, awareness for local community groups as well. We'd be very, very happy to do that.
Great, thank you, Sarah. Another question for Sean. So what about the self-tanning tablets that Main Street pharmacies sell?
Medicine legislation is fairly specific, and you could have a crossover between what is a medicine and what's a supplement. So depending on the product, really, it may be the remit of a different organization. But so long as the product has come through the proper regulatory process, i.e. the food safety or ourselves, then anything that you buy legitimately in a pharmacy has gone through that process, and then is a legitimate sale as such.
Okay, thank you. And another question in relation to that for Selena. So it says, with marketing practices, do the restrictions lie solely with sunbeds and not to tanning accelerator creams?
It's the actual sunbeds, the actual unit of using the sunbeds. Sometimes there's promotions for creams, but we have the marketing only relates to the use of the sunbed and the session of using that piece of equipment.
Okay, perfect. Again, another question for Sarah and Lauren. So you mentioned that bodybuilders and young women are the main populations using Melanotan, but did you see any other groups using Melanotan while undertaking your research?
Yeah, so it's predominantly young women and bodybuilders or gym goers using the product, so young males as well. Now, however, as I showed Sarah Ashcroft in the images, the lady with the awful burns on her skin, she you know, she was a young woman herself, but you know, a young mother. But other than that, they were kind of the main focus or target groups for the Melanotan II products.
Okay, thank you. I think we've got one more for Selena. So what marketing practices are prohibited on social media for sunbed premises, and do they have to display warning signs on social media?
So anything on social media, for example, Instagram, Twitter, Facebook, TikTok, whatever, once they are marketing the use of the sunbed, well, then it would apply. The warning sign needs to be displayed. It needs to be on the homepage, so it's there from the get-go. And like anything on site, anything that offers free use of a tanning session or a reduced rate of the tanning session is a no-go. And the environmental health officers at the National Environmental Health Service do carry out social media checks and would at that point advise and there would be official letters sent to the Sunbed business operator informing them of what's happening on their social media page. So it is actioned and it is enforced. Hopefully that answers the question.
Yeah, great, thank you.
Thanks.
I have another question for Sean in relation to regulation. Well, is Melanotan legal and over the counter in the North and in the UK?
Melanotan is illegal everywhere, absolutely everywhere. So if anyone tells you it's illegal, and you forget about it, It's illegal everywhere. It's an unauthorized medicine, and it's a serious toxic piece of kit. Don't let anyone kid you in relation to, and people will try and sell it and market it, and this business of research and not for human consumption. They're only ruses to try and circumvent the likes of customs or possible legislation breaches. It's an absolute toxic product, and we do our best to try and keep it off the market. But don't anyone kid you to say, no, it's good and it's legal here and I can buy it in Spain, or no, you can't. You can't buy it anywhere.
Well, the bottom line is that there's no legitimate source for Melanotan, really.
There is no legitimate source for Melanotan, no matter how they try and sell it to individuals. Forget about it. It's gone. It's a totally and utterly an illegal, toxic, deadly product. And I just advise anyone out there, please don't use it, please, because unless you want to become the first statistic, don't. And nobody knows what's going into these products. You don't have it hasn't come through a regulatory process. So it's no point in reading the label, because first and foremost, there is no label. And there's no what you find with regulatory medicine and food, you can track the product all the way back to the supplier. So if somebody wants to head off to Hong Kong, let them go. You know what I mean? You just cannot. These are coming out of backstreet factories in China and India. The images we've seen in relation to these manufacturing sites, we've seen them in Dublin and the country, and they're bad enough. You want to see the images coming out of where these so-called clean rooms are. Forget about it.
Very frightening. And there's one more question actually for you. So just how many prosecutions have the HPRA taken, especially since you mentioned a large number of small manufacturers in private houses?
We have a number of prosecutions pending at the moment.
Okay, thank you. And another question for Selena again. So it was mentioned that some young people are using Revolut to purchase Sunbed sessions. Revolut under 18 cards block merchant types which generally are not age appropriate for children. Considering the Public Health Sunbeds Act, is this precaution something that could be extended to Sunbed operators too?
I am not aware of that, but it's something that we can look into. Obviously, our enforcement is under the Public Health Sunbed Act, and that's where our enforcement lies. So I don't know if we have those powers, but maybe it's something to have an open discussion and a plan for the future, really.
Okay, great. Thanks, Selena. So we have lots of great questions coming in, but I suppose I'm mindful of the time and the need to bring today's webinar to a close. So just finally to say thanks again to all of our panelists, Professor Shirley Potter, Selena Gallagher, Dr. Alison Owen, Caitlin O'Leary, Lauren Dwyer, Sarah Boyd and Sean Cullen, and to all of you who joined us for the webinar today. For more information on skin cancer prevention, you can check out hse.ie/sunsmart or #sunsmart.